All right, good morning or good afternoon, depending upon where you're coming from, looking at this today. My name is Deja, and I'm here with Mr. Andrew Susskind, who will be presenting on Conversations from the Couch with SASH, and he's going to be presenting on the gratitude of loss, utilizing the stages of grief as a strategy for sustainable sexual sobriety. Good morning, Mr. Andrew. How are you doing today?
Good morning, Deja. It's a pleasure to be here. Doing okay.
Awesome. That's great. Thank you so much for participating with us today and participating with us later in the next month for the conference. Um, just to go ahead and get started, you're presenting on, as I said, the gratitude of loss, um, utilizing stages of grief as a strategy for sustainable sexual sobriety. Can you tell
hmm
us a little bit more about your inspiration behind that?
Sure. So I believe that grief and loss are something that, in general, people don't want to talk about. It's not the most, on the surface, it's not the most uplifting topic. And yet, where I come from and what I've learned through the years is that loss is part of life, right? And loss is part of addiction recovery. And so it would be remiss not to be looking at it, not to be exploring it, and not to look at ways to move through it. Because I believe that although it's sometimes taboo in our society to be talking about death and dying and grief and loss, it's really part of every single day that we live, actually. Every day that we live,
Yeah.
we're also dying in a way. And the thing about recovery and the thing about sexual sobriety in general is that there's tons of losses, right? There's the losses of what happened before someone gets into recovery, right? All of the various things,
Yeah.
relationships, jobs, health, all kinds of things. And then in recovery itself, there's the loss of the coping strategy of sexual compulsion. So there's a whole nother variety of losses that go on once somebody enters into recovery. So I don't know if you've ever heard anybody say this, but sometimes somebody will say, well, why don't you just get over it? You know, why isn't it time to just move
Oh,
past it?
trust me. I've been
Yeah,
deemed the dramatic one in my house, so yeah,
there you
I
go,
get that a
right.
lot.
Yeah, but with loss, what I've grown to believe is that the idea is how can we learn to live with it,
Yeah.
not ignore it, not somehow bypass it, but how do we learn to live with the losses? And, you know, I'll just answer your question about my inspiration. Um, Back in the early 90s, when I was just getting into the field, when I was just getting into my own recovery, actually, HIV and AIDS was rampant. It was everywhere.
Mhm.
And I was working on an AIDS unit at a hospital, and then I worked in home hospice care for several years. And
Oh,
so I
wow.
saw, yeah, so I saw a lot of brave souls. That's what I would
Mhm.
call it. And even though, again, a lot of people would say, how can you do that kind of work? I found it so inspiring. And I found so many people who taught me what it was like to really deal with life and with loss with dignity. And they were my teachers, and that's really the original inspiration for this presentation.
I think that is just absolutely beautiful, and I can truly, honestly relate on a number of topics that you just said that relate to this and how loss can be associated with addiction and recovery. We don't talk about loss and grief until it happens, right? It's always an after the fact. And I've come to realize, especially, in the pandemic, as we're experiencing so much loss and so much change,
That's right.
still wondering why we're not talking about it because we're clearly not comfortable, you know,
Mhm.
with even even the thought of talking about it before it happens. It's like, oh, you're trying to bring it up. So most definitely, I think that's a wonderful way though to connect. And you truly do see life when working with people who are forced to face with the end of it. and and I try not to sound so morbid in saying those
No,
things, but it's like death is it's a part of life, and it is a whole entire process, the before, the
right.
during, and the after. So
Yeah.
we're definitely excited to get into this topic. So
Yeah.
going more into it, um, what are you hoping that participants take away from the presentation? Obviously, they're going to learn a new connection and
Yeah.
platform. So
Sure. So one of the things that also inspires me and that I hope will inspire participants in this particular workshop is that I wrote a book recently that focused on sustainable sexual sobriety. The whole book was focused, it could have been an autobiography, but I decided to write it third person, and I decided to interview people for the book. And what I did was I thought to myself, what isn't being talked about in the 12-step rooms? What isn't being focused on in the treatment centers, in the therapy rooms, that would really be helpful and powerful possibly to help folks get some traction in their recovery and to reduce their vulnerability to slips and relapse. That was my primary goal. And one of my chapters is called The Gratitude of Loss. And I felt that a dialogue, a larger dialogue around the losses and how to integrate the losses, right? Not get over them, not bypass them, but how do we integrate loss into our life as part of the texture of who we are and part of the texture of our recovery. So I really look at the workshop as a chance, number one, to normalize loss, right?
mhm.
To really talk about it in ways that, just like you and I are talking about it, that hopefully can really be inspiring. I also want to raise awareness. I want to hopefully share this idea that dealing with losses and looking at grief can actually be a way of helping to sustain sobriety. And so in the workshop, I'm going to be talking about various tools and strategies using actually the original model, which is Elizabeth Kubler-Ross's model of the
Mhm.
stages of loss. And it's a little bit, it's a seminal work. It's something that we all learn in grad school, and it's really important to understand. But what I tried to do is kind of modernize it
Mhm.
and utilize it in a way that we could apply the stages of loss to the stages of loss within sexual recovery,
Right.
and to use it as a way to springboard into a way to strengthen recovery and like I said before, reduce vulnerability to relapse. That's really my personal goal, is to reduce stigma and also to reduce vulnerability to relapse.
I think that's really innovative. I've only had the chance to sit in once on a group per class assignment, and it just so happened to be a group for sexual addictions. And you're absolutely right. I feel like there was an immense amount of guilt or grief that was felt just from even being present. And not even saying that I couldn't feel that for them, but it was like it was so heavy, and it was like I'm looking around and I see people, it's
Right.
like you see people just simply in grief because they're trying to heal. And it's unfortunate that they're made to feel like it's so taboo, because it was like so many groups popped up, but the amounts were just so small, and they had to keep moving around and things like that. So I think this is an innovative way to most definitely get people considering it in a different light, and to pursue other methods, for additional ways of healing. So shout
Right.
out to you, Mr. Susskind, and congratulations on your book.
Thank you. Thanks, Deja.
Our pleasure. And so um, that leads me right into my next question. Um, Given the pandemic and our change of venues and environments,
Hmm.
and our daily schedules, what have been some benefits or not so great moments for you as far as your professional work dealing with telehealth? And then also,
Mhm.
what are you expecting to happen or not happen technologically with your audience in the conference from this?
Sure. It's bittersweet, right?
Yeah.
For instance, this year's conference was supposed to be in Seattle, which is one of my favorite cities, and one of my best friends lives up there, and I was looking forward to being there. So, of course, there's the loss that's associated with that. It's disappointing. But it's interesting that resourcefully, conference organizers like the SASH organizi organizers are really dedicated to creating some kind of experience that will replicate what we would have if we were face to face in person. And I've been to several virtual experiences, both conferences and one-day seminars and um, various groups that I'm in, and it's it's a stepchild, I would say. It's not like being there, but
Mhm.
it's kind of surprising how it can work. I mean, one thing that I've noticed is that there's a longing that I have to be with people in person. I miss my clients that way. I miss my colleagues, my friends, my loved ones. It's weird. I can't deny that. But at the same time, what I'm trying to do within myself is to adjust and acclimate to what it means, just like you and I are here together, Deja, right? We're here in this moment together in our virtual room, and it's not so bad, right?
Yeah.
It's the next best thing to being there, you know.
Yeah.
And I think there's
It's
a
immediate,
telephone.
it's efficient. I can say that for
That's
sure.
right. That's right. It is efficient, and right, no commute. I don't have to get on a plane to be with you, and so all of that is really, it's interesting to me intellectually, and just to talk about my practice for a moment, I I've been doing the telehealth now for 7 months, and it's, again, not easy, but it surprises me how my clients and I have both gotten used to it.
Right?
That that somehow we have no choice. So we're
Yeah.
doing the best we can with what we've got. And I have to say there's certain clients that are on hold. There's certain clients that did not want to come to Zoom, which I understand. And and because I do a lot of trauma work along with my addiction work, it's a very tender, sensitive kind of
Yeah.
personal work.
Hmm.
And so I understand people who don't feel like on a screen it's what they're looking for. And
Yeah.
it's individual choice, of course. But what's interesting is from a conference perspective, we could actually serve a wider audience,
Hmm.
right? People
Yeah.
anywhere in the world can attend, and which fascinates me. I'm curious if there'll be some
Yeah.
other countries represented this year. And I also like the idea that community can transcend being face to face in a ballroom, let's say,
Yeah.
right? And so, as much as I have mixed feelings about it, to answer your question, I feel that there's an effectiveness that can happen, and it just takes a little bit of resiliency, a little bit of flexibility,
Yeah.
and all of us have been practicing that for a while now. And so hopefully the SASH conference will reflect that, and it will be a community that comes together in a different way.
I highly anticipate that's exactly what we'll be seeing. Just as you said, it's almost like since this all happened, mental health like got its own social media platform from the way webinars and everything are just so at your fingertips, but yet the conversations still need to be had um, in order to guide, an audience and the public properly into understanding their healing and trying to access it. So, yeah, pros and cons, but mostly we're riding along. It's okay. It's not that bad.
Yes.
About the conference this year that you're excited about to see happen since it'll be happening virtually?
Well, it's an experiment, right? I'm going to a conference next week here in Los Angeles on group therapy, and
Oh, nice.
it's our first virtual conference, and some of us
Mhm.
are more comfortable with the virtual format, and some are less. And so it's a steep learning curve, but we're all learning together. And so I'm doing a few presentations between now and the middle of October, and I feel really comfortable with it. And I'm just
Yeah.
really curious how many folks will be able to join us from what areas of the country. I really like the idea that people who might not have been able to afford coming to Seattle are now going to be able to click in and be part of the experience without the cost of airfare and hotel and accommodation.
Yeah.
So it's
That's a
really
plus.
interesting. Yeah. I'm just trying to stay open-hearted to how all of this is going to come together.
Well, thank you so much, Mr. Andrew. We truly appreciate you participating with us today, and we
Sure.
look forward to your presentation, The Gratitude of Loss, Utilizing the Stages of Grief as a Strategy for Sustainable Sexual Sobriety, on Saturday, October 17th, between 1:45 p.m. and 3:15. So thank you
Central
again
Time.
so much for Central Time. Yes, thank you, because I
That's right.
need to remember we're not
Yeah, that's
everything
right.
doesn't revolve around the East Coast
Or the West Coast.
or
That's
the
right.
West Coast.
Right.
But yes, thank you so much.
My pleasure, Deja. It's a pleasure meeting you.
You as